You will now take the flat sheet and put it on. Flat sheet is also considered finish.
Joycelyn is your name?
Yes.
Hi Joycelyn, I'm Destiny from the Nipa. So we would like you to demonstrate to us the proper way of hand washing.
Before you wash hands, you take away all the jewelry.
So they have to keep it very low.
Okay. Wash your hand in the downward position. Wash the palm of your hands. Your nails. Knuckles.
They will tightly fit the top of
Both
the sheet
sides.
to the head of the bed.
The back of your hands. Your wrist. And your reins in the downward position. It has to be
There is
more or
already
less
a curve
20
at the
seconds.
corner of the bed. There is no particular matrix corner to it because there's a
Take
matrix
a towel.
corner.
Pat dry.
Why did we not rub?
Because it can cause abrasion to the skin.
Because we are now
Pat dry.
students, we are learning to work as a
You use the napkin.
and with that, if there is one person, then they can
And that same procedure would be recommended to apply if you use a restroom and
Yeah. The restroom and before any medical procedure, wash your hands in that same format.
thank you very much.
You're welcome.
To this desk. Hi.
Hi, good afternoon. This is our information corner. One of the roles of a nurse is to be a teacher. You need to be able to educate your patients on hand hygiene, the care they should expect at the hospital. For example, on the maternity ward, you need to be able to educate your patients on the importance of breastfeeding, the correct positioning for breastfeeding. So these are just some brochures that you can find at different healthcare facilities that would, when the patient is leaving, although you taught them, these would still be brochures that you would give them to guide them on how they should continue.
Even after leaving the medical center.
Yes.
And adhering to And this is the board that you guys receive instructions on for class?
Certain stuff have to be written, or we use this one for PowerPoints.
For presentation.
This one.
Alright, the screen here. And here you have more about hands-on.
Yes, more practical. You get to see the structure, the skeleton.
Interesting. I'm sure you catch a lot of jokes on that one. Thank you.
The drawer is placed on the front of the bed, just around the abdominal area of the patient and the pelvic area. The drawer sheet is used for moving of a patient and also for protection of the bleeding. We normally, if you would maybe use a plastic drawer sheet if the patient has a incontinence problem, meaning that they cannot control the urine. So we'd probably put a drawer sheet, a plastic drawer sheet. But because our patient is not going to have that problem, we'll just use a normal drawer sheet. Okay, so they're doing a very good job. Their bed linen look like it's I'm sorry, like it's tight. Yeah. And they are working very nicely together. That is the main goal for us at Nipa, is to work together as a group. Okay, the drawer sheet is on, and they are now going to get the top sheet. The top sheet is placed low on the bed to avoid any microorganisms or dust from flying, as all other sheets. It shall also be placed on the left side, so there is a particular way to put it. Yes, perfect. They shall work together and make sure that the sheet is straight and tight. Make sure each side is equal. The top sheet shall come over the head of the bed. Tighten, yes. Perfect. They shall work together and make her turn. on the side of the bed. Down to the midget corner. The midget corner is made, as I said earlier, is to avoid any wrinkles. The bed, pardon me?
The brakes don't work.
No, I'm trying.
I know, it's not your fault.
The bottom of the bed, the linen, is tucked tightly on the first. Then they will take the edge of the linen and bring it over to the bed to make a mitred corner.
Can you show us
Together.
Can you show us that corner?
Mitred corner. Bring it over. Bring the linen sheet over to show the mitred corner. Okay. Yes, it can work right now. It will then be brought under tightly and make it into a triangle. We're making a closed bed. Tightly to make a triangle. Yeah, she took this already. It's your turn. Your linen on the hair should go a little more inside. Yep. Perfect. Okay. The head of the bed should be turned, Jenna. The head of the bed should be turned down. The linen, sorry. Now this is what we call a closed bed because they are leaving just that pretty little design up here. The middle of the bed will then be tucked in tightly. You're doing a great job. Yay. Perfect. Right there. Okay. We have a slight little problem with the bed because of the steel edges, so it's a little difficult right now. The pillow. Lastly, we do the pillow. There is a special way that our lecturer taught us, and Erica will demonstrate that. To make it very easy, if you're a short person, the pillowcase will be rolled outwardly. Roll, Erica, to the short one. How Miss Brunella taught us. It's rolled outwardly. And to avoid letting your hands go all in the pillow. So we do it outwardly short. We will hold the pillow at each corner together. And she will just simply put it inside and let it go, and the ends of the pillow will enter into the pillowcase. She will then roll it out. And to make a good presentation, she will give you one of our fancy designs into an envelope. All pillows shall be placed away from the door to avoid any microorganisms entering. This is a closed bed. To make an open bed, I would just say it. You would just take, would you like to do it? Yes. Just take the top sheet and bring it lower down to the abdominal area. I'm using words, let's say to the middle area. Okay. And it shall be done neatly together, half of the bed. Now this is an open bed. Now let me explain. The reason we have a closed bed is because we do not have any patients. This closed bed, the first one, would be awaiting somebody. This is an open bed, and our patient is walking around, and he's walking around and he can do stuff. He is not bedridden. So this would be left like this. So if any other nurse comes in, she would know that someone is already occupied in that bed. Okay? So this is our final demonstration. Thank you.
Yes, thank you.
Pardon me?
Much success with your further study.
Thank you, ma'am. I'd like to have a picture with you guys.
Nurses, picture. Around the bed.
Okay.
Success. How long?
Come a little bit front. Guys, a little bit front.
Coming closer.
Wait, wait. Wait, the empty to come. It's actually next to this. Yes.